It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Pelesuji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Aloha, good Monday morning to you. Thank you so much for starting your week off with us. I'm Yanji Denise, joined by Ryan Pelesuji. This, of course, is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. And Ryan, today we are joined by a guest who always gets lots of questions. He's been on this show multiple times in his previous role as Lieutenant Governor and candidate for governor. Today, he's joining us now from the fifth floor in his official capacity.
That's right. Joining us for the first time in his role as governor is Governor Josh Green. Governor, thanks so much for joining us this morning, and welcome back to the show.
Thank you. I missed you guys.
Well, we missed you too, and there's a lot to catch up on. Let's just begin broadly. You've been in the office now for a few weeks. How have things been? How are you settling into this new role leading the state of Hawaii?
Well, thank you for the intro. Thank you, everyone, for allowing me to serve in this role. It has been hellaciously busy, and that's a good thing. It means we're solving problems. It's 2 weeks to the day that we've been at this job, and there have been a lot of big issues right front and center. For one, we, of course, had to deal with Mauna Loa, which the previous governor was finishing up, and then we dealt with some of that. That's been safe. People are safe. The eruption stopped, and it stopped short of the highway, Daniel K. Inouye Highway, which is great because that would have created a lot of hardship for the people in Big Island. Also, the air quality is okay. So that's one. We had a tragedy a few days ago, which was a plane went down, and we lost 3 of our loved ones here in Hawaii, it appears. That plane was Hawaii Life Flight, and it has an impact on all of us because Hawaii Life Flight, as you know, is our service between the neighbor islands and Oahu when patients need critical care or extra health care that they can't get in rural areas. That's a big deal. So we had to come together immediately and make sure we had redundancy of service, which is to say we took emergency action with all of the key players, General Hara, who you know well, Speedy Bailey, who runs that company, all of our EMS folks, our Attorney General, and we enacted a plan to, number one, get some jet planes here immediately. That's happened. One of those planes is actively transporting patients as we speak. A second jet is coming now. So they'll have 2 planes, and then we put backup provisions in place. So we worked with the military to have Black Hawk helicopters available if, God forbid, there were 2 accidents or 2 emergencies at the same time. Right now, they are on duty, and then we also have one on call. So that's a lot of extra service. And just to make sure that it was extra safe, I got together with some of the healthcare providers I've worked with over the decades, and we have extra physicians that will be on the planes in transport if necessary, so that we have everyone, safely tucked in if they have to be transferred. So that was a big deal. And then there's other issues. There's just regular issues, and I'm sure we'll get into them beyond homelessness and housing and everything, where we're looking at the HTA contract, and that's the future of tourism, the stadium. All of these issues are front and center for us. Plus, we have a cabinet to form, which we've done, and our family's going to move tomorrow. So there's a few things going on.
Yeah, I would say quite a busy schedule there. I want to get back to the life flight and those provisions that you put in place. How long are you going to keep those in place? And what do you think this incident tells us about the vulnerability of that system that we have for, evacuating patients from island to island?
Great question. So Hawaii Life Flight's the only company because the other company left us several months ago because they couldn't make it work economically. And that was the only reason. They didn't leave any other for any other reason. We normally get 10 to 15 patients transferred a day from the neighbor islands to Oahu or between, say, Big Island and Maui for different services. We don't really need that many transfers, but that's how many we do out of some other needs, whether it's your hospital or your providers at a different facility. This has shown us several things. One, we have to have more redundancy in services in case of crises. 2, we'll see whether or not we need another partner. We're going to have the Healthcare Association, Hilton Raethel, and those experts help us assess this going forward. There are a lot of things that came out. One of the biggest issues is why don't we just have the right providers on each of the islands? Well, sometimes that's hard. For example, there could be a car accident on Molokai or Lanai and a head injury, but we have so few people living there you could never actually have a full neurosurgical team. As much as we would like to, there's just very few people. So you'll always have to transfer in some places for some services. But we do need to have more primary care people, and we have to have enough flights and capacity. What this tells me is our physician and nursing shortage has to be addressed once and for all. And you'll hear about this at 1 today or 12 today when I give the budget briefing. I'm going to talk about much more resource to recruit physicians and nurses into Hawaii so that they can live in places of need. I'm going to mention today that we're going to authorize $50 million of capital improvement to expand Hilo Hospital. Hilo Hospital wants more medical surge unit beds, these beds that take care of people when they're in deep crisis so that people don't have to be transferred from Big Island to Oahu, and we have more doctors and nurses to care for them. It tells us that all of these things we've been talking about for years can't be kicked down the road any longer. So putting loan repayment there is helpful. We're going to increase Medicaid reimbursements to equal Medicare reimbursements. That's a wonkish thing to discuss, but basically it means paying the same amount for people who get care that are poor as those who are elderly. We should not discriminate. When we discriminate, then doctors leave the islands and we have these problems. So I'm looking at these things in a systematic way with my team. We've got great cabinet people, very thoughtful, visionary people coming on board. I hope that they'll be all confirmed by the Senate. And this is a system. These are system problems, but they get exposed when there's a plane crash. They get exposed when there's a storm. And it's my job as governor to synthesize the solutions and put them into place.
Well, let's talk a little bit more about the budget. And I know, as you mentioned, you'll be having a press conference to share more details. But from a broad scope and whatever you can tell us at this point in time, this is one of the first duties that you have to undertake as you assume into this role, as you have as governor, in order to be able to present the budget to the legislature for them to review. How much changes have you made from what you inherited from the Ige administration? How were you able to navigate through in really detailing this budget to make sure that your priorities are on there, and how many changes overall did you have to do to be able to come to the budget that you will be presented to lawmakers?
Great. Another great question. So here's the way it works. So we are mandated by the legislature to present an executive budget on this day, today, on the 19th of December. So we're doing it. Really good work was produced by the previous administration, giving us kind of a basic budget, making sure that they had done their due diligence on the housekeeping provisions, but the priorities and critical needs are going to come from our administration. So we're adding some today, and then we will add a lot more when we get the first governor's message in February, because it's a finite amount of time. We are adding priorities like the following. We're adding monies for those health solutions that I mentioned earlier. We're adding $15 million to help with the homeless crisis and Ohana zones to make sure we care for those individuals. We're adding resources for the loan forgiveness program so nurses and doctors can come to Hawaii. We're adding some general funds for bonding for facilities across the state. So the budget before was $8.832 billion proposed. It's going to move to about $9.85 billion. That's an increase mostly because federal funds are coming in that we have to spend. We have no choice but to spend them or that they lapse. And we don't want to give those resources back to the federal government under any circumstance. We want to use those for priorities here in Hawaii. So you'll see me talking about these kind of priorities. Basically, there's a lot of work that happens between the fall when the election occurs and when the new government comes in and all the new directors can put in their priorities. So you'll see priorities soon from the public safety folks. We have to improve our prison facilities. We have to figure that out. You'll see extra proposals from the human services folks because we know that a lot of people have been living in poverty. That's why you're going to also hear me talk about releasing the $50 million of call them GIAs, grants and aids, today. That $50 million, which was appropriated back in May, has kind of languished. And so I'm releasing those now before the holidays. These are going to places like the blood bank, the people that are running the Humane Society, people that run after-school services, a lot of social services for the homeless. Those kind of programs need to be in place so that we don't have people go into crisis.
You know, you also mentioned the HTA contract. We know that that is a pretty controversial issue at this point, and it is still being ironed out legally. Can you tell us where you stand on that and where you think, who you think should have that contract and how you think that should be worked out?
Sure. So I want them to work it out legally, of course. So I have my attorney general, who I have to tell you, our attorney general nominee is just terrific. Her name is Ann Lopez. She's working with them to make sure that the rules get followed because there seemed to be some breakdown that went on before we got sworn in, and that's a concern. It does appear that they were within their rights, the previous administration, to cancel the contracts legally. Now, I wish it had been worked out better. What I think will happen is, I think we obviously have heard loud and clear that there should be two things, management and marketing. Marketing is just the regular marketing that we do of Hawaii, so people don't go to other places like Mexico or far away to the Caribbean, that they come here and spend their resources here safely and intelligently. And then there's the management piece, which is tourism management from a cultural standpoint. And I think that that's highly valued. My personal perspective, just as an individual, has always been that there is room for both. And I have a great deal of respect for those two partners that have been on the contracts before. I'm hopeful that it will get sorted out. I will not be surprised at all if we do have two RFPs that will come out right after the new year, so that we can get this all done before the deadline, which is March 31st. March 31st is where the extension goes to right now, where HVCB, who's doing the marketing, would expire. But I do have to do this right, and so I'd really rather not get into too many more details, because I want the Attorney General to give me the best recommendations with this Chris Sadeasu, who's working very hard as the new director of DBED, cleaning up a lot of difficulties that we kind of inherited.
Another project that you brought up was Aloha Stadium, and we know that there have been, of course, some back and forth, some disagreements with the prior governor and those who have been working on the project within DBED as well. Your thoughts about where you would like Aloha Stadium to go in your ideal world, if you could, and if you were able to just be able to expedite this and move this forward? I mean, what do you think is the best path forward, and what will you be advocating for?
Well, obviously, in my ideal world, we'd finish the stadium. I'd come out of semi-retirement, play professional football, and have the Super Bowl here for my favorite team. But in a reality world, I'd like to get this darn stadium done with a private partnership. I'd like to do it in a faster timeline that's been proposed. I am glad that they didn't cancel the RFPs, the request for proposal, because that would have set us back. And what we've done is we've looked very carefully at this plan, and we're trying to get a better deal. We will build a stadium. We'll do it with private partners, but we want a slightly better deal financially as we go forward. And that's what my team is working on right now for the development of affordable housing. So there are two contracts that will ultimately be executed. One will be for the stadium, and one will be for the surrounding entertainment area. And I think that we can get a good deal as we do this. I think we should look at naming rights of the stadium too. I think that's valuable for us. But all things being equal, our kids deserve a stadium to play at. Our high schools, our college team, which is going to continue to improve and grow. We should have rugby. We should have professional soccer. We just got done with the World Cup. Wouldn't it have been incredible if we had a group round here in 2028? That would have, or 2026, forgive me. That would have been amazing had we been prepared for that. So in the future, we should be better prepared. And a stadium with no less than 25,000 seats, maybe a little bit more, would be good in phase one, and building that housing. So expect that P3 partnership coming out of our administration.
That P3 partnership, what do you think is an appropriate level of housing in that community? There's been a lot of back and forth in terms of the number of units that should be built there. What do you think is an appropriate amount?
Well, 4,000 is a realistic number. 5,000 is better. 6,000 would be wonderful. But we have to be realistic. They need infrastructure. One of the things you'll see in our budget, especially when we bring down our first executive letter in February, we money for infrastructure, because we have a lot of housing plans on our plate. We're going to do Department of Hawaiian Homeland Housing. That's $600 million. We have a terrific nominee, Ikaika Anderson. Going to put a great team of people around him, some from the homestead community, others from the more institutional community. All these people should work together in a kind of compassionate way. That's one way to do housing. The other way is at the stadium, to build infrastructure so we can actually have housing there. We may need to help that plan along, because there's been projections that the infrastructure to go into the stadium district could take a long time. Things only take a long time if you let them. Our administration, as you can see, in 2 weeks is, we're juggling 8 or 10 balls, and we're doing it with some, hopefully, deft acuity. We don't want to wait on these projects. That's why we need directors. That's why we need resources, which we have. I'll remind people we have $1.9 billion of surplus because a couple things. One, we did the Safe Travels program, and so coming out of COVID, we did better than anybody else. It's just a fact. Two, we got a lot of federal subsidy that has to be spent, and we have that money too. We're down to 3.3% unemployment. One of our biggest problems is workforce shortages. We have to support our workers. So all these things are there for us to actually solve some of the problems that exist in Hawaii. And we're going to use some of those resources intelligently for our own good. We will set aside, and I know you asked about the budget before, we will set aside at least preliminarily $500 million to go into the rainy day fund. That will take us to $1.5 billion set aside in case there's a deep recession. I don't want people to suffer like they have in the past when there have been recessions. But that still leaves this $1.9 billion surplus, even after subtracting that $500 million to savings. And that surplus should be used for the problems at hand: infrastructure for housing, deal with homelessness, rebuild the mental health care system, once and for all, deal with the Department of Hawaiian Homeland challenges and respect the Hawaiian community. All of these things and more, like the grants and aid that we release, are really important to people. It is kind of raining outside.
Let's switch gears because, again, we have a lot to talk about. Another issue that you will have to tackle for some time will be what happens with Red Hill. There continues to be growing concern and criticism over the Navy's handling of this. We spoke to Admiral Wade last week on this program, who shared with us their plans, their timeline, his reasoning for why they might not be able to accelerate that timeline to defuel Red Hill before the projected timeline of the middle of 24. Have you had any conversations in your capacity now as governor with Vice Admiral Wade and your overall thoughts with recent developments of this fire suppressant spill that also contaminated some of the areas around Red Hill?
Yes, many conversations, I would say overall. Barnett is the individual, the admiral that I've been dealing with most directly, although I will certainly see Admiral Wade again. We've met before. This morning, I met with Director of Health Char and Deputy Director Ho and my Chief of Staff, and we outlined a lot of these problems and positions that we have. First and foremost, the defueling. It has to be completed, and it's been delayed because of the AFFF chemical that was spilled. We can't accept any more excuses. I want to say this before we dive into this issue too deeply. Absolutely, and without question, the Green administration's position is to shut down Red Hill. That's it. I know people ping us on Facebook all the time and Instagram, whatever, and they ask what our position is. The position of your governor and the First Lady and our staff and everybody else is to shut down Red Hill. In order to get to the time when we can shut down Red Hill, we have to do a couple things, right? We have to first defuel. And defueling was slowed because they're dealing with that spill of the AFFF chemical. We don't want that chemical because it's a forever chemical. It doesn't ever break down. It can cause cancer. So they have to clean that up. We are going to tell them to bring in as many extra personnel as you need to work on all three of the phases of shutting down Red Hill. That's the defueling, which means that you have to fix all of the pipes that for years have been neglected. That's really begun because you know that they unpacked, they got rid of the fuel that was in the lines. That was safely done. Now they have to fix all those pipelines to drain it properly. That could take up to a year. We're going to try to get them to do it faster, but we don't want to cause any undue spills or anything of the sort. Then they will actually drain the entire facility, which is like over 100 million gallons of fuel. Again, has to be done safely because we can't afford to have any spills. Then you get to close the whole place. Now, the final thing, the third piece, is actually fixing the aquifer, the water. Right now, they're dumping 4.2 million gallons of water into the ocean. It's been, put through what's called a GAC, which is a granular activated charcoal process. That kind of decontaminates it, and then they dump it into the ocean. But that's 4.2 million gallons that perhaps could be used in other ways that are safe and necessary. I don't know whether it's golf courses or what have you, but we have to discuss that with them. So we have to defuel, we have to close, and we have to remediate the aquifer. Our team will be reaching out to international experts across the globe to find out better ways to use water and to desalinate water and to do all sorts of special things to make sure our water is clean. Meanwhile, we have an incredible amount of respect for Ernie Lau and his team. We need them to always be respected, honored, and there has to be transparency to them. But also, we have to work with them very closely to make sure that the Department of Health is on the same page as their group, which is connected to the county. We really are one team, honestly, and we're going to hold the Navy accountable. It's a new administration. I look at this relationship as two-way street. They have to respect us in Hawaii, and then we deal with some of the questions of that are longstanding. What do we look like when we're talking about the military going forward? What do we talk about when we talk about the bases? All of these questions are interconnected. So I expect clean water for our people. I expect them to help us remediate the aquifer. I expect them to help us with infrastructure if we've been delayed with our infrastructure because of the water problem. It's just fair. And so we're going to hold them to account, but we are going to definitely close down Red Hill. So I don't want people to continue to second guess that.
What's our leverage in this circumstance? Because at some point it feels like the Navy sort of does what the Navy wants. You know, just taking the video, for example, of those fire suppressants and that spill. Of course, we understand that the Department of Health has had access to the video and that they've been able to screen it, but the Navy has not released it publicly. They've not actually handed over those files to anyone. They say because it's part of their ongoing investigation, but that's just one small example of where they're really calling the shot. So what can the state do? You know, you sort of referenced potentially, could it be military leases? Could it be, tell us a little bit about sort of what Hawaii's leverage is in this negotiation.
Well, there's going to be a relationship that builds between me and Admiral Aquilino, who I'll be seeing later this week. So I'll be able to share, to the best of my ability, some of those conversations, whatever's appropriate. But I'll say this. It is absolutely a partnership. The military's been here for a long time, and the Hawaii residents deserve full transparency. And we'll make a decision about things like our bases and those leases based on the relationship. That's the only right thing to do. So we're not going to go forward with any additional leases of any kind unless we're working as a family here in Hawaii. That's what we all expect of one another. In fact, I'm sure that that's what the military should expect us to demand, that we have an actual healthy relationship. I'm about health in general, and this includes the psychological health of our people. And we can't be healthy if we're worrying about water, if we're worried about the health of our children because of chemicals. And the Navy knows that. The Army knows that. So these are things that play into a single relationship. When we were up on the mountain just the other day because of Mauna Loa erupting, we were up there in partnership with some of the military who provided a lot of great support. And we appreciated them to no end. It was also actually right at the Pohakaloa base where a lot of that reaction and response was being done. We worked together seamlessly as partners, and I was so grateful for that. But that also carries over into the long-term relationship here in the state. So that's an issue. Housing is an issue. As you know, a lot of our houses are used by military members, and that can be a challenge on our inventory. We have to encourage them to build extra housing on the bases because we value their support for America and for Hawaii, but also our local people have to be able to live here. So there's just so many things that are tied up when you're talking about an entity that has over 100,000 people living in your state, and we respect them as Americans. But when there's a spill like this, we're not going to take any excuses. We're not going to accept any excuses. And they don't expect us to accept excuses. I would say I'm going to be a lot more demanding than maybe past administrations have been, because these crises are sitting on my desk now, one pile after another, whether it's housing or health or just really our well-being and our workforce. We can't even have a workforce if we can't have housing. Can't have housing if we don't have clean water. We can't have clean water unless the military works with us.
There also has been some discussion and debate over what happens to the Red Hill facility once this defueling process is complete and once those tanks are emptied. Do you believe that this is a facility that should remain in military hands? And what would your thoughts be about the future of what Red Hill becomes?
My best guess right now, although I think that they are going to have to seek some input from people across the state. Also, we're going to have to talk to our congressional delegation to see what they would tolerate. Okay, first and foremost, breaking up the steel and taking it out of the mountain would cost billions and billions of dollars and take decades. I don't think that that's practical. I would guess that that's not going to be on the table. Just shutting it down for good may very well be the thing, and that land gets turned back over to us completely. I think that that is high probability as an outcome. Now, we will look at the recommendations that come. There have been some interesting recommendations that were floated that probably weren't feasible from a physics standpoint. One was to use it for hydropower. I don't think that that's likely. Another thing that was floated was using it for low temperature storage of data. Who knows? I'm not quite as smart as those guys that are running Microsoft and Intel and Oracle and whatnot. But it is an extraordinary facility. If you've ever been in there, it's 20 tanks, each the size of a football field, all underground. And eventually they're going to be empty, thank goodness. And if someone can come up with some kind of Nobel Prize winning idea, and we will ask Nobel laureates to give us ideas, I would love to hear them. But expect this to be shut down. That's the most likely end result.
You know, in your laundry list of things that you're facing that you talked about at the top of our program, you did also mention moving day. On a personal level, tell us where you are in that process and how this has all been for you as a family. Of course, we know that you have children of school age, and so this must be a big adjustment for them. So tell us about, moving into your new home.
Well, fortunately, it's only like about 50 yards from our old home, which is good. So it's close by. We're just very grateful to be given the opportunity to live in such a beautiful house and property, and to be caretakers with the wonderful docents and the nonprofit that runs it. So Washington Place is a very special site. Jamie and I hosted an open house, I think 2 nights ago, where about 200 people came and did tours of the home. We decorated the Christmas tree together, which was super fun. We're moving in, but we're in boxes right now, and we're moving in tomorrow. So it's a lot of change, but we're grateful. We're very grateful. People will ask probably, why do you move over into that house if you've got a nice little condo? It's for security purposes mostly, and to be safe. There have been some issues historically around governors, and so just to be sensible and direct, that's what we do. We follow the advice, but we're honored to do it, and we will be a very welcoming family. We hope that lots and lots of people will use Washington Place while we're there. We will do things like Christmas we'll do a Seder for the Jewish community in the coming months. I think that's in April. We'll have people come for galas when they decide that they can do good by the state of Hawaii and can raise funds. There'll be other moments where there will be historical conversations. We'll bring big thinkers to Washington Place and have dynamic discussions with leaders from around the world. So all sorts of things will be done at Washington Place, and we're grateful just to be a small part of that. Really, at the end of the day, we're a small family of 4 watching football games on Sunday, and I'm getting the family, I hope my family's not watching right now, a ping pong table so that they can play together in off hours.
Okay, a ping pong table making the move to Washington Place. As we wrap up here, unfortunately, we only have a few more minutes. But your message to viewers this morning, and as we said, we know that you're going to be hosting a press conference in a little bit. But just your overall message as you enter week number 2, as you said, and close out this year.
My message is mahalo to you for letting us serve. And I want you to know that you are in competent hands. We're going to provide leadership that you can trust and that will be on it from morning till night. We've already been tested by 2 crises, and I hope we've done you right and done you proud by making sure services stayed available, if it's medical transport services or even dealing with the volcano, which was managed mostly by the previous administration. So we're here on the job, and now we're taking up the large challenges that our state probably hasn't dealt with as well as it could for some time because of COVID and our time down. Really, we have been on pause for quite a long time. So as we emerge from a global pandemic, now we look at the problems that are out there, and it's the housing crisis, the homeless crisis, and access to services that were somewhat neglected over the last several years that we will be beefing up. We'll use the surplus prudently, the monies that were raised, and we will actually try to get some of this money back to those who are struggling the most. We know about individuals that are described as Alice families, people living at or near poverty. Our team is going to either be able to get rid of the tax on food and medicine, or we're already looking at the possibility of giving direct tax credits to those who are most poor among us so that they can get that tax credit against the food costs and the medicine costs that they've had. This might be a more strategic way to help people with young families so that they can afford food, and that tax money goes to people who need it most, not to people who maybe are high earners and don't need it. So we're going to be very prudent with the taxpayer dollars. We're going to save for a rainy day in case a collision occurs with a downturn in the economy, a recession. But we're going to be at the job 24/7, which is really what my team was asked to do, and we're honored to do it.
Okay, we're just about out of time. One last quick question. Any New Year's resolution for you on a personal level as we head into 2023?
New Year's resolution. Well, my family and all would like me to sleep more, but I'm going to do more workouts and physical training to be fit throughout the coming 4 years, just because I want to stay healthy for our people so I can be active 24/7.
All right. Well, we'll see you on those runs and walks around Ala Moana Beach Park more frequently then. Thanks so much, Governor Green, for joining us this morning. Happy holidays, and we look forward to more conversations with you in the future. Aloha.
Aloha. Happy holidays.
Happy holidays to him. And thank you all for your questions and for your input on our conversation this morning. Very interesting to hear from him. As we noted, we've had him on numerous times throughout the pandemic in his role as lieutenant governor and then, of course, as a candidate. First time we're having him on as governor, and we addressed some of the big issues that he's facing right out of the gate as he was sworn in, just at the start of this month. Talking, of course, at the top of the show about the life flight situation, the suspension of the search for those 3 individuals who went down on Thursday night. He's talked about all the resources that they are bringing in to make sure that these flights are able to occur. He said about up to 14 people a day are transported between the islands to make sure that they get the care that they need. Of course, even though Life Flight has suspended those flights, but there are additional resources that the governor has brought in to try to handle some of that overflow.
And one of the things that he also mentioned is giving us a preview of what he's going to be talking about in about an hour at a press conference where he details his budget that is due to be reported to the state legislature actually today, giving us some of those highlights, which include some investments into the medical community, as well as those for rural and neighbor island support. He also spoke about just the federal dollars that the state needs to spend, which will balloon the state budget or add to it, and make it larger than what was previously reported and requested by the Ige administration and spent overall. He also listed a few of the items that he wants to invest in. He's also going to say that he's also going to announce the release of grant and aid money to those nonprofits by the end of this year to make sure that they have those funds available. This was something that many of the nonprofits within the community were waiting on from the prior administration, which just did not happen in time before that, before Governor Ige left office. So Governor Green making that a commitment and a priority. So we should hear much more from the governor about his budget and how that's going to be shaping up as he enters his first legislative session with lawmakers next month.
That's right. We also covered his thoughts on the HTA contract and the stadium, along, of course, with an extensive discussion about what should happen at Red Hill. And you really heard him talking tough on Red Hill, saying that the state does have leverage, he thinks, in some of the military contracts and some of the negotiations that are upcoming. And so we'll see how that all shakes out. But a very interesting discussion. If you missed any part of it, of course, when we get off the air, you can go ahead and start back at the top of this video. Or you can catch us as a podcast or later today or on channel 50 throughout the weekend, or throughout the week rather. So very interesting. And on that subject of the legislature, a week from today, we will be sitting down with Ron Kochi and Senate President Ron Kochi and Speaker Saiki about their sort of priorities for the legislative session and see how those align with the governor.
Yeah, it's going to be an interesting time. We'll also be catching up with Lieutenant Governor Sylvia Luke in a few weeks as well to hear from her. A lot of movement going on at the state capitol as they enter what could be a very different looking legislature and, of course, different dynamics with the fifth floor. But still, a lot of shows left this week, which include catching up with State Superintendent Hayashi. We look forward to that conversation. We thank you for being a part of today's Spotlight Hawaii episode, and we look forward to seeing you right back here on Wednesday at 10:30. Aloha.
Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.